I just repeat what we learned before because it's the first session. It may be overwhelming for you people. So, first of all, I just go through these slides quickly. First of all, I told you people about that there are different types of researches. Some researches are observational studies, and some researches are randomized controlled trials. Observational studies can be experts' opinions, case reports, case controls, cohorts, and in all these studies, yeah, we in the lower studies, like in these studies, in case series and in the background information and even in the cross-sectional studies, we don't intervene. We just observe things, right? The cohort studies and case control studies may come under the category of interventional studies and observational too, but mostly interventional studies, right? Because in these studies we intervene. I'd give example of a cohort study again. We intervene, we give some particular therapies and drugs to patient population to check the efficacy and safety of these therapies, right? And the highest quality studies are randomized control trials. In randomized control trials, basically we randomly assign people to two types of interventions or even intervention and a control group. A control may be a solid control and a loose control. And then finally we have meta-analysis and systematic reviews in which we systematically synthesize results from all the available literature. It may be we can like pull all the results from randomized control trials and we can pull results from cohorts and case control studies, right? Case control studies rarely, but like mostly from randomized control trials and cohort studies. Let's say we have 50 articles on assessing I I won't say metformin again. Let's say we have 50 articles on assessing semaglutide. We can say semaglutide in type 2 diabetes patients. Now, what is the cumulative results of these 50 studies? So I perform meta-analysis on this thing. Let's say I have a cardiac surgery procedure. I have acute normovolemic hemodilution in cardiac surgery. Now, I performed a meta-analysis on this thing and I had 40 RCTs. The results of one RCTs were different from other RCTs. What the practical guidelines would follow? It would follow the results of the meta-analysis. What are the cumulative results from all RCTs? I have to pull results from all RCTs. I have to give a collective results to the community. So I perform meta-analysis. This is simply about meta-analysis. This is all again meta-analysis. Then I told what is the PICO of meta-analysis. Before performing meta-analysis, I must be sure that the studies which I am including, what is the patient population of this present on in these studies. It would be P or patient population of my meta. Then what is the intervention given? See, always when we perform meta-analysis or always when we perform research, the interventional studies, I can say the cohort studies and randomized controlled trials, we give two types of therapy. We give one intervention and the other control. We are comparing the two therapies in a particular patient population group and we have to assess the outcome. For example, if I am assessing the efficacy of semaglutide in type 2 diabetes patients, so what will be my outcomes? My efficacy outcomes, what are the efficacy outcomes? Efficacy outcomes are basically the effectiveness of a drug. So the drug is hypoglycemic drug. My main outcome would be glycemic control or reduction in blood glucose level. It would be my outcome. Now I have to compare my intervention and control for this particular outcome, that either my intervention is lowering the blood glucose level or my control is lowering the blood glucose level, right? And the outcome again, I say what are the results of my particular drug therapy. So there are two types of outcomes. I would go in the details of outcomes in the next section. There may be efficacy outcomes and there may be safety outcomes. Efficacy outcomes means the main function of that particular drug. If I am studying semaglutide, so main function of semaglutide is either body weight reduction. Most of us use semaglutide injections for weight reduction. So its efficacy outcome would be reduction in body weight, and its efficacy outcome would be reduction in blood glucose level. What are its safety outcomes? Safety outcomes mean what are the adverse events of semaglutide? Safety outcomes may be um, diarrhea, vomiting, nausea, skin rash, abdominal pain. All these are outcomes. Like all these are the effects of semaglutide on our body. All the effects we can say are outcomes. Study design, again, I'd say it can be RCTs or observational studies. I'm repeating because like most of the mentees were understanding. So this was all about PICOs. In meta-analysis step, I explained PICO, I explained how to do literature review. Literature review, something which comes from experience. You have to scroll around for different articles in journals. You have to compare, you have to see what intervention is given, what is the patient population in this particular outcome. Like you have to understand. What is the control? And it's not important. In some articles, control is not given. Then it is called single arm study. You know, double arm studies mean there are two arms. One arm is intervention and the other arm. There are some studies in which we are just assessing intervention without even comparing to control. So these are single arm studies. It's not like mandatory that every study must have your control. But if you are performing meta on something in which you have your patient population, you have your intervention, you are like including a control in your meta. But if you have a study in which okay, the patient population is same as you want, you have the intervention as same you want, but the study has no control, it is single arm study, you definitely have to exclude that study because you don't have control in that study. You can't include that study in your meta. Its PICO is different, it doesn't have any um control group. Okay, so literature review I told you before. Now screening. What is screening? I made search strategy. Search strategy I made like this. I can't create the search strategy again because it would be too much time consuming. You can rewatch my recordings. So I made search strategy like this. I combined all the key terms for my intervention and for my control. Now I had searched this search strategy on at least three databases. PubMed is our primary database. We don't consider Google Scholar as database because Google Scholar has the data, all the data which is available on PubMed. So PubMed is something a recognized thing and a standard thing. So I would go to PubMed. I made my search strategy. I remove these things. Okay, I made the search strategy. There are 13,434 articles. And what is my PICO? What basically I am seeing? I am seeing efficacy and safety of metformin. Basically, I am assessing metformin in type 2 diabetes patients. Now, 13,434 articles doesn't mean that you have to include all these articles in your study. See, PubMed gave all the articles related to each of these key terms, whether all the articles present on type 2 diabetes, like all the articles having type 2 diabetes are present in these 13,432 articles. All the articles having this word is present. All the articles having this word is present. So the search strategy covered all your keywords. Now you have to screen the articles and you have to select all those articles from this screening which have your PICO, which have your intervention, which have your control, which you have your particular patient population. Got it? Let me know, is it clear up till now?
Yes, clear, ma'am.
Yes, screen isn't shared. Sorry, my screen wasn't shared. Sorry. Okay. I'd say again, I'd repeat these words again. What I said before is clear.
No,
I
we
rem
understood the summary.
You understood the summary. Okay. What I was saying now, that I created my PICO. I was basically up to this step. I made my PICO. I did the literature search. Now I am doing screening. For screening, I created my search strategy. This is my search strategy. Okay. I searched the search strategy on PubMed. Now PubMed gave me 13,434 articles. It doesn't mean that these 13,434 articles are to be included in our meta. PubMed just gave us all the articles in which all these key terms, at least one of these key terms were used. PubMed just gave us all those articles. Now, we have to screen these articles and select all articles from these 13,434 articles which have our particular patient population, intervention, and control. Not control. Control in a sense, I have selected my control as either placebo or standard of care. So I'd select only those articles which have placebo or standard of care as control. If any study comparing metformin to any other drug, even metformin is my intervention is given patient population and that article is same which I want, which is type 2 diabetes, but my control is any other drug, I would exclude that article because my control in this pico is either standard of care or placebo, right? So I would exclude that article. Now what I would do, I can't screen these 13,000 articles manually here on PubMed, opening each article, seeing its patient population and intervention and control. So what I would do, basically for screening, we have a software and it's called Rayan. I'd show Rayan to you people. You have to import articles to Rayan. First of all, you have to install Rayan in your laptops or in your mobiles too. You can use that software in your mobiles too. You have to create your account and then I show you now. I haven't Rayan on my desktop. I directly access Rayan from my Gmail, but it takes a bit of time. I don't know what is taking too much time. Okay, I'd search Rayan here. Once I invite you people to Rayan, you people have to search the same way. Hmm. Till it's loading, guys, let me know. Do you have any questions or any queries I can clear? It's a big, like, bulky thing, so it takes time in loading. If you people have any questions, you can ask me. And yeah, again, journal selection, I'd say simply go to Google. For example, if we have people here from ophthalmology, so search on Google for different ophthalmology journals and subscribe those journals. I don't know why it's not loading. Yeah, so this is my Rayan. Once I invite you people to Rayan, you would get the same type of email. What you have to do, you have to go and search on this access to the review. Access the review thing, okay? Once you access the review, since it would be your first time, uh, once like I'm inviting you people after the session for screening, so you people have to make account here. Now my account is already made, so I just sign in here. And you people can save the password so that like you don't forget every time you open up the Rayan. So yeah, this is a screening tool. I have to import all these 13,000 articles to Rayan now. Okay, now what I would do, see how I would import all my articles to Rayan, and after that, like I would show you how to do screening. I'd click on create a new review. What is the title of my review? My title of review is metformin for, okay. In choose the review type, you people would choose systematic review. as the name implies, systematic review and meta-analysis. The review domain, so our review domain, since we all are medical students, so biomedical. Description, there is no need of description. All the headings with these aesthetics are must. I write create new review. Okay, after this I am done. Now what I would do, I would go to my PubMed. This is the first step. Okay. Once you make your search strategy and you search your articles, you have to click this send to, उसके बाद citation manager and all results, not all result displayed, not all results. Okay, all results. Now, since I have already used my PubMed too much, so they are saying that first 10,000 citations would be saved instead of like 13,400. It's the first time showing this error. Most of the time it doesn't show. Okay, I'd say all results. Okay, after that I'd click create file. Now, once I created my file, this file would start downloading. This is the file which is started downloading. Again, I am repeating, once you make the search strategy, go to your send to thing, then go to your citation manager thing, then all results thing. If people click all result displayed, so see PubMed have pages. It's the second page of PubMed, and if I go to the first page of PubMed, all result means how many results are displayed on the first page. It would just show 1000, even not 1000. I don't know how many articles it show, but mostly see, yeah, 20 articles. It's showing only 20 articles. So if you click all result displayed, it would just save your 20 articles, not that 13,000 articles. So you have to click all results, right? Then you have to click create file. Now this file is downloading. Since it's again a bulky file, it is taking time. Once this file is downloaded, what you have to click select files from here. Let's say I have another file. Yeah, it's downloaded. It's downloaded. I'd go to the downloads. I'd go to the downloads and this. I would click on continue. Now this would be downloaded. Like all the results, all the 13,000 articles would be uploaded here. Once it's uploaded, like here it would be taking too much time, but this blue line must come until here. Once this continue thing is able to click, you have to continue, and then the third step would be invite members. And invite members, you just have to okay, I can't wait for this because it would be taking too much time. I'd be showing another review to you. But once it is uploaded, you have to click on this invite members and you just have to give emails in this Rayan. Like for example, I'd give my first email, like emails of those members who are to screen the articles. All the screening persons shall be invited to Rayan. So you would copy paste emails from anywhere. Like you must have saved emails of all the screening members. Once you invite all the members, just click continue and all peoples whom you invited to Rayan would get email in this form. Okay, once you invite people to Rayan, then how it would come? It would be in this form. Let's say I have uploaded this thing. Okay, so once I upload all articles to Rayan, first of all, what I do, for example, I created this review for methotrexate for pulmonary sarcoidosis. This was my PICO. I created this review today. So I performed all the steps as I mentioned before. And once I created this review, in this overview thing, I imported like I got 241 results from PubMed. I created proper search strategy like this. Then I imported articles to Rayan and there were 241 articles. Now there are duplicates in these articles. Once you, for example, when you import articles to Rayan, there would be showing zero duplicates. So you have to click detect duplicates thing, right? So once you click detect duplicate things, out of these 421 articles, there are 11 duplicates. Now I have to resolve these 11 duplicates. How I would resolve? I would resolve like this. I would click continue resolving duplicates. Right? Now duplicate means there are two articles like on the same which PubMed or which Rayan is saying that like these two articles seem same to me. So if I'm like now I would have to assess if really these articles are duplicate or not, or just Rayan is saying this because you know Rayan is something AI thing or it's a software, so we have to check now. Now, like what I have to do, I would say again, I imported articles, I have to detect duplicates, I have to wait how many duplicates Rayan is detecting. Now I waited for it, Rayan detected 11 duplicates. Now I have to resolve these duplicates. Now in order to resolve these duplicates, this is the right, this is the left side and this is the right side. Are you people getting me? Kindly respond so that I can proceed. Are you people getting up till now? Okay. Is everyone clear? Guys, is any question, do let me know. Okay. So now I have to resolve these duplicates. What I would do? I'd assess both of these sides. Here it is written treatment of sarcoidosis. Here it is written treatment of sarcoidosis. Okay, the title seems the same. Authors. Authors aren't the same. Right? Authors aren't the same. Publication date isn't same. It is of 2015 articles and it is of 2011 articles. So do you guys think it is are these both duplicates of each other? Okay, now journal. This journal is Clinical Reviews in Allergy and Immunology, and this is something I don't know how to pronounce it. Maybe it's written in I don't know which language it is. Okay, but these journals are different. DOI, I can't like detect DOI now. I'd go to the abstract. First, check the title, then check the authors, then check the publication date, or either check either of these. But it's important, must check the titles. Then you people can check even the author's thing and then directly come to the abstract. Just superficially read the abstract. In journal, psychosis, the treatment should be offered to palliate symptoms. Psychosis is a common disorders. So I am seeing these abstracts are different, completely different abstracts. So now what do you think? Are these duplicates of each other? Tell me in comment section. Are these duplicates of each other? No, they are not duplicates of each other. So what I would do, I would say keep both articles. Now, okay, this thing is resolved. Again, I encountered another article not seeming same to me. Authors are different. Year of publication is different. It is 1994 article and it is 2025 article. It is Sarcoidosis Journal. It is Clinical Reviews Journal. Even the first lines of abstracts are not same. I write keep both articles. Again, keep both articles until and unless you get different type of articles. Now see the error of Rayan. Rayan is saying these both are duplicates, but to me these weren't duplicates. Okay. Now these again are different articles. But let's assume these two articles. Okay, sorry, my duplicates are resolved. See, I resolved all 11 duplicates. I had to show one thing to you people, but now I just explain it manually. Let's say two articles are not duplicate of each other. Then you have to see the database. For example, one article is from PubMed and the other article is from Scopus. So you have to select that PubMed articles. For example, like the right side article was of PubMed and the left side article was of Scopus. So what you would do, you would click keep right. For example, the left side article is of PubMed, so you would click keep left. Like it's just a suggestion. Rest depends on you. If articles are exactly duplicates of each other, then it's up to you which side you are like keeping. So keep right, keep left, keep right, keep left, depends on you. And if not duplicate, just say keep both. Once all of the duplicates are resolved, then what I have to do, I have to go to the screening thing. Now I have to screen my articles. Okay, we would just simply understand the things in Rayan. Basically, all we have to do is in this screening section. See, first thing is all articles. All articles mean how many articles are imported to Rayan. Undecided articles means how many articles are undecided, like how many articles are unscreened. Excluded means, okay, wait, I'll show you. Excluded mean how many articles I excluded. Maybe means if I am confused, like I'm confused, this may be included, may not be included. So I'll just click maybe. And included mean the articles I include. Okay, so this section is all articles undecided, excluded, included, and maybe. Okay, now coming towards this blind on things. Blind on means, for example, if I imported 241 articles to Rayan, and let's say I invited Hira to screening 2, I invited Rashid to screening 2, and I invited Manu to screening 2. Now, and I assigned that you three have to do independent screening of these 241 articles. Like each have to screen these 241 articles. So all of you may see decisions of each other. For example, Hira is doing screening. She included this article, and now like Rashid is just cheating, or copying the Hira's articles. Rashid, without even seeing the title and the abstract thing directly included, because Hira included this thing. For example, like like I am doing this screening. So Omama, and if like let's say Hira is screening this article too. So if I included this, Hira tick would become then here it was written Rashid tick. So to avoid the bias, we click on this blind on thing. Now in blind on, we don't see decision of each other. For example, if you three are doing screening, if Rashid is doing screening of this article, and already Hera has done screening of this article, Rashid won't be able to see the decision of Hera that has she excluded this article or included this article, right? So for this purpose, we do blind on. If I blind off this thing, so it means we all can see decision of each other, what the other person is doing. So this is blind on and blind off concept. Got it? Now, another thing. We have just 6 minutes remaining, so how we have to do screening. In order to screen the articles, I have to read the abstract of the article. Sorry, the title of the article. Let's see. My intervention is methotrexate for pulmonary sarcoidosis. I am assessing methotrexate for pulmonary sarcoidosis. Now, my main focus of concept is methotrexate and pulmonary sarcoidosis. If this is the article, diagnosis and treatment of pulmonary sarcoidosis, a review excluded. I guess it might take it might take 10 minutes more because like it's need a bit explanation. Now this another article I encountered, pulmonary sarcoidosis, a comprehensive review past to present. It's a review of pulmonary sarcoidosis. I can't include this. I would click exclude. Okay, molecular mechanism of action and pharmacokinetics properties of methotrexate. It's just methotrexate thing. I'm not seeing my particular intervention in it. I would exclude it. Right? First line treatment of pulmonary sarcoidosis with prednisone and methotrexate. Again, my intervention is only methotrexate. I'm not interested in any other drug with methotrexate. I would exclude it. Immunomodulatory treatment of interstitial lung disease. Okay, again I would exclude it. So this is screening on the basis of title, or like superficial abstract. You have to see your particular intervention and control in your article. If your intervention and patient population in your article, if your particular intervention and patient population is present in an article, then next you have to see the study design. In the study design, you have to exclude all the review articles, and mostly, like in Rayan, if anything is to be excluded, they would have highlighted it as red here, as I'm seeing here. Yes, here. Not even here. I guess it was the first or second article, but it was written review, in the review, and anything written such as, like, it's not highlighted yet. But if any article is to be excluded, the Rayan would give it you a clue. Reviews are always excluded, so Rayan would have highlighted review as red to you. So it means you have to exclude this thing. Now, again, I'm saying first you have to see your intervention and control. If your intervention and control matches, then you have to see the study design. And in abstract, for example, this is the abstract, right? In abstract, the first lines are of introduction, then aim, or the study design thing, up to the middle part is study design thing or method thing. In methods thing, you would like get your study design, and last your conclusion and all the results. So your main thing in abstract is to just look for the methods, what they have written. They would have specified the intervention, control, and study design on in methods, and you have to do screening on that basis, right? Now, refractory pulmonary sarcoidosis incidence after treatment with methylprednisone or methotrexate. Again, I would be excluding, because, like, see, a retrospective observational studies. Let's say I am including just RCTs in my meta directly without even seeing the titles thing. I would get idea from this. This is observational. Retrospective studies are always observational studies. Basically, retrospective studies, cohort studies are of two types: prospective studies and retrospective studies. Again, I had explained this thing in our upcoming lectures, but for now, retrospective studies are observational studies. I would exclude this, right? Methotrexate pulmonary toxicity. Any one of you tell me, is it to be included or excluded? Tell me quickly, we have just 2 minutes remaining. And also tell me, do you want to continue this lecture for 10 more minutes, or I shall continue in my upcoming session? But I just want exclude. Okay, exclude. Sarcoidosis associated pulmonary fibrosis. Nothing about my intervention. Exclude. Methotrexate as initial therapy for pulmonary sarcoidosis. Okay, I don't have abstract for this from title. I'm seeing include. I do its full text screening and see it is to be included or excluded. Okay. Guys, please tell me, shall we make another meeting link? It would just take 10 minutes or 15 minutes. But, like, if we don't continue now, then it would be too difficult to catch up all these things in the next session. So I just want to finish up the screening thing in this lecture, so you people may be able to, like, do the task. Okay. Maria,
Okay.
sorry, Mahnur, kindly
I'm
end
ending
this
the
meeting
recording
and
here, then I'll make the new link, okay?